Hello, my name is David Ford, and welcome to our first broadcast of our new YouTube station, Fort Public Health. I really welcome everyone for being here and clicking on our link. Um, this is really dire time, as everyone knows that we're going through the worst pandemic that the world has ever seen through the coronavirus. So, through the urging of many of my friends and colleagues, decided to start this channel for public health in order to have discussions about important issues, public health issues, and also to just raise awareness as well. Again, my name is David Ford. A little bit about me is that I am from Massachusetts originally, and most people may know me if you live in this area as I'm the managing director and CEO of a public health and healthcare consulting firm that we basically go and we consult with hospitals, HMOs, home health agencies, nursing facilities, and also municipalities, states, municipalities, cities, towns, and public health focused organizations to help them do better strategically wise, better being preparedness, many different things. We're there to develop a lot of strategies for them to do better in their practices and their mission. So many people may know me in that respect. Also, some people may know me that I'm on a number of different public health focused boards, including the Board of Health of the City of Worcester, which is the second biggest city in New England. Keep in mind that this is, I'm not promoting or saying that I'm representing any entity here during this on this particular website or YouTube channel. I'm just giving you a little bit of background about me. I've worked in the healthcare arena and the public health arena for 30 years, actually a little over 30 years. So I've worked for a number of hospitals, HMOs, public health entities, from managers, director positions, for many years. I'm also a social activist, public health activist throughout Massachusetts and many areas that I've lived in before. From an educational standpoint, just a little bit about me is that I have a Bachelor's of Arts, a BA from Colgate University in New York. I also have a Master's of Public Health from the University of Michigan. When I was there, it was the best public health program in the country. We're in the top five still. Premier, it's a great institution. Learned a lot. Obviously, it has shaped my life. After that, after I left public health school and graduate school, I went on to work for many years. And in 2013, I ended up getting a master's of my MBA as well as my master's in finance. Master's of Finance from Northeastern University in Boston, and I got the MBA and the Master of Finance because I wanted to learn more about the inner workings of healthcare organizations to be able to drive them and be able to consult them and help them to do better work, especially in terms of basically increasing access to many people in their communities. So that's my background right now, my educational and academic background. But this site, let me just kind of tell you this, as I mentioned at the very beginning, this site, this channel, I was urged on by many of my friends and colleagues to put something on out there to just answer some questions, to talk about different issues, public health issues. For many years, public health was not seen as something that was really important. And in many respects, I understand why people would think that. But the key element is that we're here to promote healthy living, healthy attitudes toward and taking care of yourself, about community health, population health, trying to basically do a lot of things to encourage protection of our communities, of our health, and so that you and I don't end up in the hospital for something that could be avoided. Now, the public health realm goes all the way from medical issues when it comes to diabetes, heart disease, to all the things like crime and violence, domestic violence, gang violence. Could be anything to do with, like, for example, this coronavirus issue. Could have to do with smoking, vaping, many different issues. depression, anxiety. A lot of things can be talked about. So the bottom line is that public health has a big range, and now it's coming into the forefront. What we've always been here, but now it's one of those things where we're forced to really talk about this industry and what we do. My background, as I mentioned, has been a lot to do with working for many different hospitals, HMOs, and public health entities. And I'm a policy person. I'm a policy professional, as well as being on the ground, working with the community in many different communities that I've been in. So that's something that's really important to me. So this channel is something that we're going to be doing a lot of discussions, a lot of talking about different issues. I'll give you my perspectives as well, and hopefully you'll be able to get something out of it. I encourage your questions. Please click on the like button and just keep those questions coming in, and I will continue to answer those questions for you. And we will continue this in our next many different episodes, just kind of talking about some issues. But now we'll be focusing a lot on the coronavirus issue, because obviously this is unprecedented. This is something that we've never seen before. This is something that this pandemic is something that in public health school we talked about this, the possibility of this happening, but even when you're in it, it's still surreal. So this is not unexpected for many public health professionals. But again, it's definitely sobering when it does happen, when it's happening. So we will definitely discuss that. And again, continue to bring your questions. And if you have anything that's pressing, please just hit that urgent button, and we will talk to you and follow up episodes. Thank you for your time. We'll talk more. Watch further episodes. Thank you so much.